Organ donation is often called the gift of life, yet across the U.S., experts say there aren't nearly enough donors. I'm Tisha Powell.
And I'm Lee Zurich. In fact, about 17 people die every day waiting for an organ transplant. And every 8 minutes, another name is added to the national transplant wait list. They are mothers, fathers, grandparents, siblings, even children. Advocates we spoke with say living organ donors could be a critical solution to this deadly problem.
Reporter Heather Grath goes in-depth to explain what some view as barriers to donation and the push for change.
Do you have more work today?
Like many couples, Annabelle Gary and Martin Glusker enjoy spending time together, cooking meals together.
Oh, I have a question for you.
Living life together.
We've been dating for almost 4 years. We met in college.
What's perhaps less common is that Annabelle and Martin decided to give life together as well.
I'm so grateful that I was able to do it.
Each of them donating a kidney to a stranger, with Annabelle's surgery happening in April 2023 and Martin's in March of 2024.
Neither one of us were gonna say, you have to do this with me. But I think it makes a lot of sense because we both had the same reaction when we first heard about it. And for most people, it's very safe to donate a kidney, and there are a ton of people who need one and are gonna die without one.
So we both did a decent amount of research. There was some good podcasts we listened to, some good articles we read. Reading all these really human stories, it felt like a moral failing that all these people weren't getting kidneys. I think every single one of them deserves it.
Government data shows the critical shortage. About 90% of more than 100,000 patients on the national transplant wait list are in need of a kidney. Yet, in 2023, there were just about 16,000 deceased donors and 6,900 living donors.
So there is very much a need.
LaVarn Burton is president of the American Kidney Fund, and while a transplant recipient's insurance will cover a living donor's medical expenses, she says there are often indirect costs that are not covered, and believes that added bill can discourage people from signing up to be living donors.
For example, will I, if I'm a donor, have a harder time than I otherwise would getting life insurance or disability insurance, or in some cases even health insurance? Will I have to pay out of my pocket, take money from my family in order to do this good thing for somebody else?
And these are not hypothetical barriers. These are issues that you guys hear about from real living organ donors.
Absolutely, these are real issues that people face. What we're trying to do with living organ donor protections is to increase the number of people who are able to say, I want to give the gift of life.
What needs to change here?
Well, one of the things that needs to change is we really need a national law. We need to enhance protections for people throughout the country and make them consistent.
On Capitol Hill, Congressman Jerry Nadler of New York told us he first learned about barriers to living organ donation about 12 years ago, when one of his staffers gave a kidney to her own child.
Well, she couldn't get insurance. She was discriminated against in life insurance afterwards for having donated a kidney.
Does that feel wrong to you?
Yes, it's absolutely wrong.
Since then, Nadler has introduced numerous bipartisan bills trying to right that wrong. Most recently, in 2023, the Living Donor Protection Act would prohibit insurance companies from denying new coverage or increasing current premiums for living donors. And the Living Donor Tax Credit Act would provide a $5,000 one-time refundable tax credit to donors who were not previously reimbursed for costs related to donation.
We ought to want to encourage organ donations in every way. We want to save lives. And that's what this is about.
From the medical perspective, transplant surgeon Dr. Stephen Potter says there's no question living organ donors make a difference.
Living donor kidneys are better than deceased donor kidneys for two really important reasons. One is you don't have to wait for them, and the second reason is they're higher quality.
Potter works at MedStar Georgetown University Hospital in Washington, D.C., and serves as a committee chair for the American Society of Transplant Surgeons. He thinks the removal of financial disincentives could help increase the number of living donors.
Absolutely, I think it would.
But he's keenly aware it's illegal to buy or sell organs in the U.S. and says it's important any proposed changes don't seek to compensate donors, but rather offset their expenses to ensure organ donation is a cost-neutral act.
At ASTS, we really feel that we should focus on removing disincentives because we don't want to create a situation where we're essentially paying people for donating organs.
Potter also happens to be the surgeon who removed Martin's kidney back in March.
It was very smooth.
So easy.
I was in the hospital for one night.
As for any donation-related costs on their end, Martin and Annabelle say they were lucky enough to get reimbursements through the nonprofit National Kidney Registry and feel strongly that more support for living organ donors is needed.
Anyone who decides to make that sacrifice should not be punished for helping save someone's life.
And though the couple has yet to meet their transplant recipients,
Dear donor,
about a month after Martin's donation, he did receive this handwritten letter from the woman who got his kidney.
to change the life of a total stranger who you may never meet makes me feel very privileged to have part of you with me.
A message of gratitude
I would like to say thank you. I truly appreciate your sacrifice.
he will never forget.
It's very sweet.
It's really sweet.
Every year, the American Kidney Fund publishes a living donor protection report card that grades each state on its living donor laws. For instance, whether they require paid leave from employers, protection against insurance discrimination, and tax credits or direct reimbursement for donation-related expenses such as travel or lodging. In 2024, the AKF says just 3 states received an A grade, while 5 states got Fs, found to have 0 policy protections in place for living donors.
Advocates say there's been some progress at the state level. In 2023, New York became the first state to pass legislation that provides direct reimbursement to living donors for expenses not covered by insurance up to $10,000.
At the federal level, Congressman Nadler's attempts to pass living donor protections have not yet advanced, but he says he will keep trying. In the meantime, there are a few existing programs that offer financial support to help offset a donor's out-of-pocket costs.
And you can find those resources right now on investigatetv.com.